putting them on an opioid, which has such a high addiction rate and fatality rate, I don't think that's a smart move. Because once they cut them off, they're still addicted and they're going to turn to something else. Opioids do nothing to improve the outcome of a patient. It's just to make them more comfortable. We got to ask ourselves, what's wrong with being a little uncomfortable? If you have a knee replacement, I don't want people to be in pain, but that's a painful thing. You have part of your structure of your knee cut out. So when you have a knee replacement, it's going to be painful. If you break a bone, it's going to be painful. If you cut part of a bone off, in this case, they're cutting off 2 bones and pounding in another device. I certainly don't want people to suffer through that, but putting them on an opioid, which has such a high addiction rate and fatality rate, I don't think that's a smart move. Because once they cut them off, they're still addicted and they're going to turn to something else. And I know other people that have done that exact thing. Some of them to pull through it, and some of them didn't make it. So that's number one. Number two, high blood pressure medication, cholesterol medication. Do I want people to have high blood pressure and have their heart explode or their vessels explode or having a stroke? No, I don't. But that does nothing to fix the problem. It temporarily alleviates the crisis. It doesn't fix the problem. Same thing as cholesterol medication. Cholesterol decreases your body's ability to process fat. So they look at one marker and say certain fat levels are too high. So let's give them something to stop that fat level from being so high. Your brain is 75% fat. When you start messing with your fat handling or fat production in your body, you're going to affect the brain. And now there's resources coming out saying, okay, it could be a link to dementia, which has skyrocketed since these drugs have come out. And when I first brought this to the attention of my patients back in the 1990s, I was verbally crucified by medical people in Pennsylvania that were saying, oh, that chiropractor's crazy, don't listen to him, he doesn't know what he's talking about. But now studies from pretty respected sources are coming out saying, yeah, there could be a link. There could be a link to this. Same thing with antidepressants. Antidepressants, they don't really actually cure depression, and they actually don't restore serotonin. What we were told was it's low serotonin that causes depression. There's a lot of people that question that now. But antidepressants don't restore serotonin levels. Exercise does. Even a spinal manipulation does. Adjustments do that. But the drugs don't do that. They just trap the serotonin you have, which is a neurotransmitter, in the synapse of the nerve, which means you lose some control over your thought process. That's not the safest thing. And some of these side effects that are coming out now, which I've been shouting for years, homicidal and suicidal thoughts and tendencies, it's scary. I just saw an article saying not one school shooting involved somebody who wasn't on these drugs or coming off of these drugs. We got to stop looking at everything as every symptom has to be handled. And we have to use a drug to handle every aspect of that person's discomfort and start looking at how do we get that person healthy. For the first time in my lifetime, we have people in Washington in Health and Human Services and in Medicare actually agreeing with what I just said. And they're starting to look for non-invasive ways to get people well. So chiropractic, I'm a chiropractor. That's an alternative fringe outside thing. And they're looking at that going, what we notice is when people get chiropractic, that has a great potential of reducing the cost of healthcare and improving the patient's overall health because it's a functional correction, not a symptomatic correction. A lot of people misunderstood chiropractic for years. I've heard doctors and other sources in healthcare say, oh, chiropractors are abusing their power because they're treating people when they don't have a symptom. Whoever said the symptom is what we're treating? It's not. It's the underlying function. Here's an example. If you're driving down the road and your front end starts to shake and you go out and look at your tires and they're worn down unevenly, if you get new tires, it'll probably improve the ride and decrease the shaking. But why were they wearing down unevenly? They were wearing down unevenly because the alignment was off. You have to get a front end alignment. If you did that, that would get rid of the shake, plus the car would run better. The other one would just be a temporary fix, and eventually it's going to go the same route as the first set of tires. And it gets pretty expensive because you have to keep buying tires. And it's dangerous because you could have accidents because of losing control of your car. So I think for the first time in a long time, Americans are starting to think the way I'm talking right now. Not all, but a lot more than in the past.